Hello everybody, this is Gary. Today is April 27th, 2022. It's 5:18 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my coping with schizophrenia blog entry for today. Today I'm doing all right. Didn't do much today. Went to the pharmacy to pick up a couple prescriptions, my blood pressure medication, and my Klonopin. Came home, did some work on my computer, and then decided to make this video for today. My schizophrenic symptoms today are pretty much under control. My paranoia is not too intense. My hallucinations are not too intense. My depression's not too intense. My anxiety levels, I think, are pretty normal for me. Today is a better day than it was yesterday. My moods tend to fluctuate. My paranoia tends to fluctuate. Anxiety, depression, hallucinations tend to fluctuate from day to day. I am in quarantine for a few days because I found out yesterday morning that I tested positive for COVID-19, the coronavirus. The test was a requirement before I have knee surgery, and it came back positive, so I had to cancel that knee surgery. I have a torn meniscus in my right knee, which is very painful, and I wanted to get this surgery over with. I mean, there would still be pain from the surgery itself, obviously. But I've been walking around on a torn meniscus for at least 4 months. 3 of those months not even known that it was a torn meniscus until I got an MRI done. I had already had an x-ray done, but they didn't show any broken bones, and a torn meniscus doesn't show up on an x-ray. And I also believe my orthopedic surgeon says I have some loose cartilage in my knee, which is also causing pain. So they're going to remove part of the cartilage as well. The meniscus is sort of like cartilage. It's used as a way to cushion the knee, like a shock absorber would on a car. So I was supposed to have the surgery day after tomorrow. Can't have it because I'm in isolation. So we rescheduled everything. I have another coronavirus test on the 9th of May, and we're planning to do surgery on the 13th of May. So that's about 2 weeks away, give or take. And hopefully the coronavirus test will come back negative and I won't need to cancel the surgery a second time. I'm not feeling sick. I don't have any symptoms of coronavirus. And I was vaccinated. I got the 2 first stages of the Pfizer vaccine and then the booster shot. And obviously that's not enough to keep you from getting infected. But I think I may not be sick because I did get vaccinated. I mean, when I say sick, I mean that I'm not feeling any symptoms of coronavirus. I'm not nauseated, no fever, no headaches, no body aches. My right knee hurts, but that's because of the torn meniscus. I'm not having any new aches or pains or anything like that. I have arthritis, and that pain is normal for me. That's been around for years. So I'm not having any pain or anything like that from coronavirus. I'm not experiencing anything that I haven't experienced before coronavirus, before I was found out to be infected. So my next COVID test is on the 9th of May, and my surgery is scheduled for the 13th of May. A lot of anxiety around surgery. The surgery will be outpatient. It will be done in an outpatient clinic. I imagine I will be put under general anesthesia. They'll do 2 incisions into my knee. I guess one is for the camera to look inside the knee, and the other is to actually do the surgery. And the surgery actually shouldn't take more than a half hour, the doctor said, maybe 45 minutes. So it's being done outpatient. It's not even being done in the hospital. So I'm not spending the night in the hospital or anything like that. But when I get home, when I get discharged, I will be on crutches, possibly for 2 or 3 days, or even longer. So I will make sure I have all the supplies I need, my prescriptions, my over-the-counter medications, food, that kind of thing. Because I may not be able to leave my apartment comfortably for a while. Because if I walk on my right knee too much after surgery, obviously that's going to cause physical pain, and I want to keep that to a minimum anyways, because walking around on my knee when I just had surgery might re-injure my knee, and that's obviously something I don't want to do. And of course, having physical problems makes it more difficult to deal with mental illness. I've been having this pain in my right knee for about 4 or 5 months. Didn't find out it was a torn meniscus until early March, I think it was. We scheduled the surgery, and of course, like I said, it was canceled and rescheduled. As far as seeing my therapist, I can't see her. I was supposed to see her today, in fact, but we rescheduled the appointment until the 10th of May, so just before surgery, I will be seeing my psychotherapist. And on the 5th of May, I will be seeing my psychiatrist in person, because by then my quarantine will be over with, and I'll be able to see my psychiatrist in person. As far as my psychiatrist is concerned, I believe he's leaving my clinic sometime in June or July, so I will be changing psychiatrists soon, whether I like it or not. I'll still be going to the same clinic, have the same psychotherapist, but I will be getting a new psychiatrist because my psychiatrist is a resident, which means he's going to have to move on to the next stage of his career and education as a doctor, and I will probably be assigned a new resident. I will be assigned a new resident at the clinic I'm presently going to. And once my knee heals from a surgery, I will be going back to group therapy, hopefully. I was going to do another 8 weeks of group therapy, but the surgery and planning for surgery and the pain in my right knee made it impossible for me to keep a weekly schedule of going to group. One of the rules of group is to not miss more than 2 weeks out of the 10-week period, and I just don't think I could have kept that schedule with all the doctor's appointments I've had and the specialists and all that. I wasn't able to keep up that group therapy schedule. But the therapist that runs the group therapy does want me to return to group in the next 10-week session, just because she thought it was a good idea, and I agree with her, it's a good idea. So at some point in the future, I'll be returning to group therapy, and I will be seeing my therapist regularly, even after my psychiatrist changes. It's always hard to adjust to a new psychiatrist. They have different styles, different philosophies, different ways of doing things. So, I don't want things to change too much when I get a new psychiatrist. I'm satisfied with medications I'm on right now. I think they work well for the most part, and I don't want any major changes. I did ask my psychiatrist for an increase in my Zyprexa, but my insurance company wouldn't approve it, so I didn't get the increase. My psychiatrist might have to appeal personally to my insurance company to allow the increase in my Zyprexa. I take the Zyprexa when my auditory hallucinations and paranoia get really bad, and they've been more intense, along with my anxiety and depression, due to the pressure of my knee pain and upcoming surgery, and the canceling of my surgery. When I'm under stress, my auditory hallucinations, paranoia, depression, anxiety have a tendency to get worse, and physical pain doesn't help any. Still taking the same medications that I took for pain before. I'm not taking any opioid drugs. I'm taking Tylenol, Aleve, Flexeril, Neurontin, and Cymbalta for physical pain. Nerve pain, musculoskeletal pain, arthritis pain. It's possible that I have fibromyalgia, although my medical doctor has not made that official diagnosis yet. But I am taking those medications, especially the Cymbalta, for the nerve and musculoskeletal pain. And aside from my right knee, most of the pain is under control. My right knee hurts when I have to walk on it, obviously. And I will have to continue physical therapy with my right knee and the rest of my physical therapy once I get out of surgery and I start to recover. But that's all for now.